Bangladesh shelters more than 1 million Rohingya people who were forcibly displaced from Myanmar. Despite having spontaneous response from national and international communities, there is still need for basic services. The influx has also overstretched the resources in the locality, putting huge impact on host communities. A consortium named Sundarbhabe Bachi Shobai, which means Let's Live Happily Together, in short Shubash, started its activities in 2020 aiming to improve the health, safety, nutrition and livelihood. Overall, the well-being of both Rohingya and host communities with the support from US Bureau of Population, Refugee and Migration. To ensure better healthcare, the consortium's 3 hospitals provide 24/7 primary healthcare services in camps, which includes specialized support for non-communicable diseases, mental health and psychosocial support and family planning. Within 1 year, there has been significant changes in healthcare-seeking behavior among Rohingya people.
আর গরম মধ্যে রাতে 2টা বাজে যেত মধ্যে আর বহুত ডেলিভারি হলা পেন উঠে আই এখন কি গজিম বাফিতে টাইমের মধ্যে হসপিটালের হল আনা নম্বর পাই আই হল লাইনলে হত হই মত হসপিটালে তো হতে ভলান্টিয়ার ফাটাই হম ভলান্টিয়ার দাইরা আর হসপিটাল মধ্যে আইনে ইয়া বাদের দিন আর 12টায় সুস্থভাবে আর ফুয়াগো হসপিটালের মধ্যে হালাছে
এরে ডাক্তার হানার ডাকে দিল দেমাকর ডাক্তার আসিল দিয়ান আর তুন জানানো আসিল আর জানিয়রে আর বাইরে হলো দিল দেমাকর ডাক্তার হানার কলারে আসি তাহলে আর হেনতুন বেশি মদত পাই।
Earlier data show that 48% population were dependent on pharmacy as a first point of treatment, whereas the recent data show that 89% people are seeking health services from this established health service point, and out of them 97% showed higher level of satisfaction towards health services.
As a part of integrated services, each hospital has a protection corner, providing gender-based violence-related legal and psychosocial assistance, maintaining confidentiality that encouraged more people to seek support.
আমাদের ভলান্টিয়াররা ডোর টু ডোর ভিজিট করেন এবং এই কর্নারই কেসগুলো রেফার করে থাকেন। এই কনসোর্টিয়ামে 13টি প্রোটেকশন কর্নার রয়েছে যেখানে শতভাগ গোপনীয়তা নিশ্চিত করে কেস ম্যানেজমেন্ট করা হয়। একই ধরনের কার্যক্রম আমরা হোস্ট কমিউনিটিতে করে থাকি। এছাড়া সাবসেক্টরের সহযোগিতায় আমরা কেস ম্যানেজমেন্টের এসওপি ডেভেলপ করেছি যা অন্যান্য অর্গানাইজেশন ফলো করে থাকে।
People feel empowered and enabled after being exposed with the consortium's wide range of training sessions. Adolescent girls are more aware about their rights and support system. Mother-in-laws are now more supportive to their pregnant daughter-in-laws, while the attitude and practice of men are also changing regarding child marriage, dowry and GBV-related issues.
তো আরা ইয়ার আগে বুঝিতাম দে হামদাসে ভাগ্য যে মরপর বুঝিতাম মায়াভার বলে বুঝিতাম এখন আরা মিটিং আনামে বুঝি দে হামদাসে এটা হন ভাগ্য জানাই বাজারতে আছে এখন মাছ আনিলে আছে বউয়ে আছে মাছিন কুড়ের আজ আছে তরকারি কুড়ি হামদাস আগে দেরি টাইমে হামদাস চড়মাই যার গই।
The project's nutrition program helps to prevent and reduce health risks for women in the community. With its unique social behavior change communication approach, the Mother Care Group model has created massive awareness on mother and child nutrition among women.
We are implementing nutrition-sensitive activities, focusing on Golden 1000 days using care group and social behavior change communication approach to improve optimal infant and young child feeding practices and to improve nutritional status of pregnant and lactating women. We are also promoting nutrition-sensitive livelihoods, especially homestead gardening in both Rohingya camps and host community, which is improving dietary diversity.
Shubash reached a milestone by setting up a system in its working area to manage and prevent rickets, a disease that prevails highest in Cox's Bazar due to calcium deficiency. The project's livelihood program, such as homestead gardening, goat rearing, small business, small cottage industries, and vermicompost, helps to ensure food security and diversity in the host community. People have adopted climate-smart and innovative agricultural methods introduced by this project. With more than 200 entertaining creative IEC materials, people now not only have scope of getting consistent, accurate and timely life-saving information, but also are inspired to act and engage in bringing sustainable changes. Being exposed through hundreds of listening groups, people express their satisfaction accessing the trusted information which helps to improve their lives.
In terms of communication, community engagement and accountability, the project has taken an innovative, modernized and human-centric approach to keep the affected community at the center of the response and to improve the quality of their lives. We have disseminated those information products to the community with a set of very skilled practitioners. They have received in-depth training, mentoring and hand-holding support on interpersonal communication skills and group facilitation.
Another major achievement of this project is localization, where the capacity of the local partners are strengthened and enhanced in terms of networking, financial management and scope of work.
এই কনসোর্টিয়ামে কাজ করার সুবাদে আমাদের কর্মীদের সাথে সাথে প্রতিষ্ঠানেরও রোহিঙ্গা কনটেক্সটে কাজ করার সক্ষমতা বৃদ্ধি পেয়েছে। ইমপ্লিমেন্টেশন পার্টনার হিসেবে আমরা নতুন নতুন চ্যালেঞ্জ নিয়ে কাজ করার জন্য সক্ষম বলে মনে করছি।
Constant support and engagement of government officials in every step helped not only to implement the activities but also reach the milestones.
I would like to request all our donors, partners and implementing agencies to give a special importance about family planning and continuing all other activities in the camp.
As this refugee crisis moved into its 5 years, in this protracted crisis, we need to continue life-saving primary health care services along with integrated protection program to reduce gender-based violence. We also need to invest in disaster preparedness as this community exposed to natural disaster.
Since 2020, the U.S. State Department's Bureau of Population, Refugees and Migration has been supporting IRC's Delivering Health, Nutrition and Livelihood, Protection and Community Engagement program. This joint effort between IRC, BBC Media Action and Concern Worldwide aims to reach around 4 million people, focusing on Rohingya refugees and their surrounding Bangladeshi communities. With a comprehensive, multi-program approach, they aim to bridge gaps in healthcare, nutrition, and information dissemination. This inclusive endeavor strengthens accountability and access to gender-based violence services and fosters collaboration between refugees, host communities, the government of Bangladesh, NGOs, UN agencies, and other stakeholders. Notably, the program has provided essential health care through dedicated centers, transforming behaviors, improving women's safety, shifting social norms, ensuring proper diets for children, and increasing knowledge on infant and young child feeding. The community engagement component has successfully overcome barriers, empowering the community to hold humanitarian responders accountable and positively influencing nutrition and health practices. We look forward to continuing our support and collaboration with IRC.
In just a year, facility delivery has increased in both Rohingya and host communities. The Rohingya communities feel more about the importance of diversified food. Women and girls are now more aware about where to report for support and services in both the communities. The data clearly indicates the momentum, and more is possible. With diverse multi-sectoral services and an integrated approach, Shubash is committed to support people to have healthy and improved lives.